This is a More Complete Beast podcast where we discover and distill strategies to drive the needle forward on your life. Today, we're sitting across from Dr. Anthony Petrarca, and we're talking about common injuries in the gym, how to avoid them, and how to treat them. If you're a fitness enthusiast, make sure you buckle up and stay in this ride for the entire time because we cover a lot of ground. Again, this is a More Complete Beast podcast. Leave us a 5-star review wherever you're listening to this and share this podcast. Now let's get into it.
Yeah, I mean, my dad's a chiropractor, so it always started, he started the rehab center and it kind of, it took off. We have 8 offices now. So like, I've always grown up around there. We didn't always have a babysitter. So I spent a lot of time in the office and got to see like a lot of physical medicine going on, a lot of rehab stuff. That's why we're called the rehab center. That was his vision, was to like, do chiropractic, but also, a rehab side of it, stuff like that. So my autobiography would probably be, I don't know, I guess starting, with probably fitness, like wrestling and stuff like that. I think that was probably the transition from that to knowing that I wanted to do things with athletes, knowing that I wanted to do stuff, to try to get people feeling better, especially you guys know the grind of like wrestling season. By the second half of wrestling season, everyone has an injury. Mm-hmm. Sometimes it's really bad. Sometimes you can't wrestle. But everyone's got like, you tape these fingers together, or you wear a knee brace, a knee sleeve on this side. Mm-hmm. You get your ankle taped at the trainer on this side. And it's just like, there has to be a better way. You know what I mean? And the athletic trainers at the school were fine. They were great. They did what they were supposed to do, but that wasn't like long-term health. You know what I mean? So knowing like, and my dad is good at running a business and he's good at being a chiropractor, but like, I think there was some room to grow there too. You know what I mean? With stuff like that.
I worked at the rehab center, obviously, for I think 2 years, mm-hmm. 2 summers.
Yeah.
And that's what was cool about it, is because it wasn't just chiropractic care. Although I guess chiropractic care is a larger umbrella, if mm-hmm. I'm not mistaken. It could be a lot of different things. But there was a gym. The one that I worked with was like the small gym attached to it, decompression therapy. Mm-hmm. There's ultrasound. I got to learn how to do that. And then the stim and roller, and then chiropractic treatment after that. So like we would come in and it would start for a new patient. We'd go into the x-ray room. We would take x-rays if needed, and then do some corrective exercise, and then the stim and roller bed, and then anything else. It was like a big circle of different therapies to go from where you were all the way finally to the adjustment. And then, you would come out the other side. So it was like a circle in the Apollo office.
So most people consider, like when they say chiropractic treatment, you're talking manipulative therapy. That's like when most people talk about it, they mean getting adjusted or getting cracked, like some people say. That's, that's a good type of treatment that we do, but that's not all we do. I think one thing that we do really, really good at the rehab center is that, we kind of don't have a standardized form of care. It's like you come in, you get assessed. What you need is what you get. It's not like, everybody goes through the same gambit and, results may vary. It's not like that. So it's like, we get you assessed, take x-rays if it's medically, needed, or if we think that it would help with our treatment. And then we have, a bunch of passive therapies, like you mentioned, ultrasound, stim, intersegmental traction, decompression therapy. We have a ton of exercise equipment for stretches, exercises, stuff like that. But everybody gets a little bit different thing when they come, and we get all kinds. We get athletes, we get people who dig ditches for a living, miners, like everything. So not everybody. It'd be kind of a waste of time for them and a waste of money for them too if they were getting stuff that wouldn't really help them. You know what I mean?
And I do think that's what I noticed when we were in the Apollo office. The people that had the best results did what they were supposed to, if that makes sense. It was like, they wouldn't just come in and like, all right, go. It would be like the guys or girls that got the best results were like, hey, this is some corrective exercise. You can come here 15 minutes early and actually do this. Well, the people that did that and did all the therapies actually got a lot better.
I don't know if you want to jump into this right now, but now that you bring it up, the one thing that makes a bigger difference than anything is how much somebody's willing to put into getting better. Like if you're there, I will give you 100% to try to get you as better as I can. But it's gonna require something from you too. You're mm-hmm. not just, it's not like, taking a magic pill or a supplement. Like if you just let this be done to you, or you just pay what it costs or something like that, You'll get better, but for you to get as better as fast as you can, it's going to require something outside of the treatment room. And those people get the best the fastest. And a lot of people don't understand what they're supposed to do. Most people don't really know. A huge part of my job is patient education, because you can't even imagine how many people have no idea about nutrition, no idea about exercise, no idea about ergonomics, nothing. Like, they're clueless. And the people who want to learn those things and want to at least know enough of it to make their life healthier always have the best results, always.
That's no doubt about it. I mean, if you come in, you're like, oh, my back hurts, and it's like you're lifting incorrectly, you're 50 pounds overweight, you sleep 2 hours a night because you have sleep apnea, so your spine never decompresses. You're doing everything wrong. You might feel better after an adjustment or the therapy or the decompression, but like, what are you doing outside of that to facilitate, okay, you feel better because of this adjustment and this therapy, but what are you doing outside of that to be better outside of just the temporary, or I don't want to say temporary, but the transient pain relief that you're getting at that moment, because it works together. Chiropractic care, at least when I work there, and the approach that you take is more of, when done correctly, isn't just a adjustment, come back, bill the insurance until it's completely gone. It's a holistic approach of, like you said, patient education, changing their lifestyle. It's like you don't come into a chiropractor without, like, you have something in your life that's creating an issue. Sometimes it's temporary, it's transient. You lifted something incorrectly, which we're going to get into about, like, different stuff you see at the gym, working in the gym, I should say, different things you see with injuries. But it's like, sometimes if it's like chronic, like, what are you doing in your life that you can correct? Come to the chiropractor, get the therapies, get the education, and then execute on it. If you're not going to do that, like, what are you doing?
You're just there to get better for that time. But then there's no preventative aspect to that either. So, like, and don't get me wrong, from a business standpoint, if you keep tweaking your back and you keep coming in, that will grow my business. You know what I mean? But that doesn't grow my business as fast as getting somebody 100% healthy. And then they tell all their friends, hey, I feel better than I've ever felt. And I went to the rehab center. I saw Dr. Anthony. I feel amazing. That grows our business way more. Our word of mouth. We hardly do any advertising. The majority of new patients are word of mouth. Like, they treated my sister-in-law, or, I saw you at the gym and somebody came out and they were talking about how much better they felt. Stuff like that. Like, that gets us way, way more business than the same people. They're hurt. I treat them a couple times and they feel a lot better. And then they get hurt again in like 4 weeks. You know what I mean? Because they're still doing the same things wrong. And a pretty common myth that you probably heard is, like, once you start seeing a chiropractor, you always need to see a chiropractor. And it's like, no, it's because you're still doing the same stuff. You know what I mean?
Right.
The thing that you did that hurt you, you haven't changed. It's still there. So, yeah, I mean, if you did feel better with treatment, that's going to be that kind of system where you injure yourself in a similar pattern. You come in, we fix it, and then rinse and repeat. You know what I mean? Which is frustrating for me, because I feel way more rewarded whenever you're totally healed and that you're not going to do those things anymore. And you have nicer things to say about me, honestly, because you feel better. You know what I mean?
I was going to touch on the point that you just said, that it's way more rewarding whenever you have a client or a patient that comes in and wants to do the little things better and continues to make progress. It gets me at least more exciting from a training perspective with an athlete. If I have a person coming in and we've talked about something to execute on, and they come in and they said, yep, I'm doing that great, I'm ready to take the next step. Sometimes it's frustrating whenever you have a person that comes in and they continue to do the same things wrong, and they're missing appointments and they're not coming in. It's, although you're still there and you're going to give your best effort, it's almost like a headache at that point. You're like, this person's coming in again.
You're dragging them along.
Right.
They're paying for progress, but they're not doing all the things that'll get them there as fast as possible.
And a big part of that for us is the nutrition aspect. Like, people will come in a couple hours a week, 2 or 3 hours a week, and they'll train, and they might work hard and they might make progress. But if their goal is to lose body fat, it's like, okay, you're doing no effort outside of the 2 hours of week here, which is great that you're doing 2 hours a week of progressive and good exercise. But if your goal is actually to lose body fat, if your goal is actually to change your body composition, everybody in this room knows a lot of that comes into what are you doing outside of the gym? So like Zach said, we run into a lot of people and we'll take your money for as long as you want. And we're going to try everything we can to try to get you to do the right thing. But if you're not going to have any sort of effort or compliance outside of the small sliver of time that you spend in chiropractic therapy or in the gym, you're really not going to get that much out of it.
Yeah.
And like you said, long-term versus short-term. Short-term money is easy. Stay fat, come in here until you realize you're wasting your money and then leave. Long-term though, long-term progress in business and all of your customers is getting the results. And then eventually they're like, oh my God, people go, damn, you look great. What did you do? Well, I've been going to Wallace and, I lost 30 pounds doing this, this, and this. Now all of a sudden the business starts to grow a lot faster than just having the same, X amount of fat people or X amount of injured people that just keep coming back again and again and again and never getting results. You can't force any compliance with that, but it sounds like that's something that all of us kind of deal with.
In the industry of trying to get people better, just whether it's, it's probably true for people who are for their financial health, for anything. Like if you're trying to get people better, you can lead a horse to water, but you can't make them drink. You know what I mean? Mm-hmm. It's that same thing. We can do everything on our end. But if somebody doesn't want to do the things themselves, they're not going to. You can show them the way, but if they don't walk it, they're not going to get to where they want to be. I mean, I was thinking about this on the way here. There's a ton of overlap in our industry between yours and mine, other than obviously, like the baseline. We're working with athletes, or we're working with normal people who want to be more athletic or something like that. But like, it's total health. You know what I mean? Like you said, you guys are trying to tell people how to eat better or steps they can do in their life to try to make themselves healthier. I'm doing the same thing, just more, our starting point's probably different. Yours is, they need to change something about their life. Mine is they're hurt. But other than that, like the jumping off point's different, but where we're trying to get is exactly the same, a healthier person. So
being in the gym, you work in a gym, Zach, Colin, and I, we all work with customers. There's a couple of recurring, I guess, pain points, no pun intended, that a lot of lifters or athletic people or people in the fitness space kind of deal with. The first one is back pain. Usually people that are deadlifting, they're squatting, sometimes cleaning, different variations of deadlift, they will start to get some lower back pain, not like mid back, but like very low into the hips. Kind of want to dig into that real quick. Mm-hmm. Obviously you can't diagnose everybody over a podcast. You don't have a patient right in front of you. It would be almost malpractice to be like, this is always what it is. But generally speaking, what is that lower back pain that's caused by people who come in and exercise in the gym?
Yeah. So obviously I have to preface this with, I'm not giving you medical advice or anything like this. This is medical advice for anybody. If you have back pain, if you have any kind of pain at all, this is, general health tips. But if you want anything checked out, anything looked at, you have to go to a medical professional, whether it's a chiropractor or your regular medical doctor, anything like that. You have to go see somebody. This is not a diagnosis. Okay. But now that we got that cleared up, there, as far as low back pain goes, there's a couple main culprits. You have to distinguish between exactly what's going on, because some things may feel similar, but it could be very different problems. And doing a certain thing for one problem isn't going to get it better if it's something else, right? So typically from what I see, people who hurt their low back exercising, it's like one of three things. It's either your lumbar erector muscles or your QLs, which are two different muscle groups that both kind of do different back functions. So that would be like a muscle strain. You spend too much time in flexion. You're demanding too much of a muscle group that aren't strong enough to do that. So like we see this a lot with deadlifts, or even like really I see it a lot with bent over rows. People have their backs arched a little more than they're supposed to, and then they kind of rotate on it. And your lumbar erector muscles, they help in extension of the back, plus your QLs, which do, a lot of that same function with a little bit of rotation, that will injure those muscles if they're not strong enough to do the weight you want to do, or especially guys that kind of throw a row back. You've seen that before, I'm sure, a ton of times. And then they kind of stand up and they're like, oh, when people say like you tweaked your back, that's usually what they mean, is like a muscular strain. Those are not bad enough to kind of stop you dead in your tracks. But that's the kind of thing that will not get better if you keep doing the thing that is bothering it, right? If every back day, every pull day, you're in, a hyperflex position, you're trying to like throw around a little bit more weight than you're strong enough to do, and your back hurts the next day every time. That's not right. It's not muscle soreness. That's not, the normal building muscle hypertrophy.
Yeah, it's a load management error. You did too much than your body was capable of.
Right. Now, the fortunate thing about that is it's probably the least severe out of like the major back injuries. Usually if you change the technique or if you lighten the weight, a lot of times that will resolve. We can do some things to help speed up the recovery to that. That will typically get better on its own if you just stop doing the thing that is bothering it. But a lot of people, you'd be surprised. They're like, yeah, every pull day for like 2 years, it hurts a little bit for like 2 or 3 days after. I figure that's just muscle soreness. I'm like, no, that's not really how that's supposed to feel at all. So that's probably the most common one, but it's also probably the least severe. Another one is like lumbosacral pain. So that's where your lumbar spine meets your sacrum, which is the lowest spot of your spine, or you have your cervical spine, your thoracic spine, your lumbar, and then your sacrum and coccyx. So like right where your belt line is where your lumbar spine meets your sacrum. Now that area is a very common injury area, and it's very common to injure things pretty badly in that area. So this is, somebody was hitting a deadlift and maybe they weren't breathing right, or they didn't have their belt on right, or they weren't wearing a belt, or they twisted, they tried to jerk the weight up, stuff like that. You're talking risking pretty serious injury. You have discs in between each vertebra. And when you put too much strain on those discs, especially in a forward flex position, that disc material will get compressed and it has to go somewhere. So sometimes it will go out, like back towards the spinal cord.
And is that a herniation?
So that would be if the inside of the disc comes all the way out, that's a herniation. So you can also have a protrusion. There's multiple levels to this, but they all kind of vary in severity and duration. But needless to say, you don't want to mess with any of them. So that's when people are like, yeah, I hit a deadlift and now like my quad feels a little weird, or like down my leg, like my toes are tingly, stuff like that. Like that kind of decreased sensation, paresthesia, stuff like that. Or, I don't know if this is fine for your listeners, but like sometimes people will have issues using the restroom. Like they either need to, but can't, or can't hold it, stuff like that. Mm-hmm. You can affect those nerves depending on the severity. And if there's sequestration of the disc, like you can have some pretty serious long-term repercussions with that. So needless to say, you want to avoid that altogether. That's probably the worst. Sorry, were you going to say something on that?
I was just going to say that happened to me once. I did I was like drunk the day before, had no water. I was just like, didn't sleep, came in. I was trying to hit what I could hit for 5 at the time. I was a little bit like heavier. It was 540 for 5 is what I was going for on a deadlift with like dehydration, just three quarters of the way drunk. And I tried to pick it up and like, it felt like almost an electric shock in my back. And then it went all the way down to my heels. And then I pissed myself a little bit and I was fucked up, like bad shape. The next day I was trying to put my socks on, and anytime I'd bend over, my hamstrings would start cramping. Like I literally could not get my socks on. So I just like threw them on the ground and just tried to slide my feet into them. I couldn't bend over. Like something happened during that deadlift, and I couldn't deadlift for like 11 months after that. Anything over 225, I would get this like almost numbness, tingling kind of sensation from my glutes down to my heels. I couldn't deadlift over 225 pounds for almost a year. And then it eventually, by avoiding it. And I probably should have went to a chiropractor, but that was a different time in my life. I wasn't doing anything but working and attempting to lift weights when I could. It took a long time to get better, and I was in bad shape, like bad shape.
Did you ever get an MRI or anything?
No.
So, if without any imaging, so obviously we always like, if it's that degree of pain and discomfort, especially there's something called cauda equina syndrome. Like if you're having issues with bowel or bladder function, we always recommend you try to get, see some kind of professional to get an MRI, because that is serious. You're lucky you didn't have any long-term issues with that, because sometimes it can damage the nerves to the point where like people always have a little bit of incontinence after that. Mm-hmm. But I mean, definitely sounds like it could have been, anything from a protrusion to a herniation, or even if you injure the actual disc material itself, we call that an annular tear. So something like that, anything that caused inflammation to the spinal cord, really, it sounds like what you did. And you end up in what we call an antalgic position, where you try to lean away from the pain. And anytime you like either straighten up or put a load on it, you start getting that paresthesia, you start getting the numbness, or some people will get weakness in the legs, like flat-footedness, stuff like that. So, I mean, that's risky business. I'm glad that you made a full recovery, but
I'm hard to kill.
You probably should have got it checked out.
So we got the muscle strain, we have the nerve or disc injury.
Yeah, disc injury.
And then there was a third one?
Yeah, sacroiliac dysfunction. So a lot of time, we talked about where the sacrum meets the lumbar spine. So the sacrum also has two other joints, which are your sacroiliac joints. That's where it connects to your pelvis. So when you feel like kind of your low back and you feel those little bumps on each side, that's that joint. That's where the back of the pelvis is, and underneath there's where the sacroiliac joints sit. There's a lot of fibrous ligament there, and that's a very important joint. They don't move a lot, but it's still very important for like pelvic flexion, stuff like that, and even a little bit of pelvic extension. It's tough because that's kind of the load where the load hits your hips, right? So like, your lumbar spine meets your sacrum, then your sacrum, if your weight's coming straight down on your sacrum to get to your legs, it has to diverge, right? So that force I'm talking about, the force has to go through your sacroiliac joints and into your pelvis, then into your, femurs and down your legs. So sometimes this can also be happening in a forward flexion position, but a lot of times I see this kind of injury when people are kind of dipping their pelvis, like if they're doing a squat and then they bring their pelvis forward like real hard, or they try to push back real hard from that like deep squat position. Maybe they're not strong enough to do the weight, but like, you know what I mean? When you round your pelvis, when you're trying to hit something heavy, and then you get up and you feel like there's like a little pinch. The way I describe it is like if somebody's sticking their thumb kind of like right in that little bump of your back, people like can't quite get comfortable. Again, unless it's very, very serious. This isn't typically something that's going to give you like long-term issues. This is something that is recurring. We see this a lot. Like if you sprain those sacroiliac ligaments bad enough, like people will, every time I squat, if I go over 400 pounds, I feel it like right here in my hip. They'll say their hip. That's not really your hip joint, but it's your sacroiliac joint. But very common. I mean, I'm sure you guys have met people, or a lot of times people will kind of lean, if they go to sit up, they'll kind of lean forward and try to like help themselves up. That's usually, that same kind of joint issue.
I'm not sure if that's just clickbaity right now, but I feel if we hear that somebody's dealing with some discomfort, most of the time it's always SI pain. People always think it's my SI joint, or I deal with a little bit of SI stuff. I don't know if that's the common diagnosis right now, but for at least myself, I feel like that's what we hear the most working with clients.
Yeah, we have a lot of people that'll say they'll have very low back pain that radiates into their hips.
Yeah, so that can cause your sacral nerves. If it's irritating the sacral nerves, you can feel that kind of radiating pattern. It's really common, but it's also, so I don't want to say it's clickbaity, but I do think that it's one of those things that people who try to diagnose themselves will come up with because they start Googling stuff and they're like, well, it's kind of on the side and whatever. But that could also be lumbar radiculopathy. You know what I mean? So without somebody checking it out, it's hard to say, but that is like a very or I saw it on I saw it on Instagram, and now that they mention it, that is kind of how it feels. You know what I mean?
The WebMD doctors.
And sometimes they're right, but you don't want to, come up with that conclusion and then be treating, like we talked about earlier. You don't want to treat for it. And then, at home, they're like, well, it says to put, this on it. And then if I do these stretches, but if it's not that, it's not going to get better. You know what I mean? So I'm sure some people are right when they say that they have it, but, it's probably part of a guess too.
Since that is a joint, what is the best way to recover from that? Is there obviously, what would be your take with that? If somebody comes in with some SI pain.
It's tough to say. History is a really big part of what we do, is asking like a patient's history of how the injury happened, stuff like that. Because true injury to the actual cartilage of the SI joint is pretty uncommon. So typically when people say that they have an SI issue, they really mean like the SI ligaments that support the joint. The sacroiliac joints are like wider, flatter joints, and they have some rough parts to it that some other joints don't have. You can get those, they can catch a little bit. Sometimes that happens. But if you have a sprain to the ligaments, that will cause that more frequently, or you can just feel the pain in that superficial area itself too. So like, you know, to get anything better, especially joints and ligaments don't get a ton of blood flow. Joints are avascular. Cartilage is avascular specifically. Not every part of your joint is avascular, but cartilage and ligaments don't get a lot of blood flow at all, not nearly compared to your muscles. So doing things to increase blood flow to that area typically help, like stretching. Ice is going to help with pain management, but I do think that there's a lot of research coming out that ice might actually slow the healing process a little bit. I prefer heat to try to get that vasodilation, get blood flow to that area, get it feeling better, faster, especially with athletes. And you guys work with athletes too. Like a lot of these injuries happen mid-season, or a lot of these injuries happen. They're like, I need to get better before this tournament, or I need to know what I need to do to try to minimize how much pain I'm feeling when, I have this event coming up. Because telling, if somebody's whole life is a sport, telling them like, hey, you can't do this, that isn't in the cards. I've tried and people say that's unrealistic. So what can I do? And it's like, okay, well, here's what you're going to do. Try to get it as much better as you can, or try to make as much progress. But, as far as your question goes, different things are, required, whether it's stretching or typically movement. I'm a big fan of movement, but moving in the right direction. So any movement is great for getting blood flow to areas. It's great for loosening up things that are obviously tight, but it's not just about that. But sometimes the worst thing you can do for certain injuries is nothing and just sit there and just baby it. And yeah, it'll get better and maybe you won't hurt so bad in the meantime, but you're going to push that duration that it's bothering you way out. I mean, every time, you've seen those people, especially, guys that work in like labor or something like that, they stand up different. They don't always just spring up. You know what I mean? They kind of like work their way into a standing position. You know what I mean?
Mm-hmm. Right.
Like that is, you can deal with it, but it's not going to help. You know what I mean? So pretty much I would see exactly what's going on first. Cause like I said before, not every patient gets the same thing.
An individualized approach, but a general consensus would be movement, blood flow.
Yeah, movement, blood flow. Typically, I mean, there are certain conditions that can get worse with blood flow, but those are usually not like athletic injuries. Those are, God forbid, like tumors or something like that. You don't want to increase blood flow to something like that. Not that we deal with that, but some injuries you don't want to increase blood flow to, but almost all of athletic type injuries, it's not a bad place to go wrong because that's what's going to get you better. You know what I mean?
And that's what that, manipulation of chiropractic care, like the traditional, when somebody thinks, get cracked or whatever, you know what I mean? People around here say
manipulation. Yeah.
That is to facilitate movement and blood flow to an area.
Movement specifically. Yeah. So like, if we're doing it for you, if you've ever seen somebody treated for SI joint pain, a lot of times we'll do like a pelvic drop adjustment or a certain pelvic techniques to try to, and it's, small range of motion, but you're just talking, like I said, the SI joint doesn't move a ton, but if we can increase a little bit of movement within that joint, people will tend to feel a lot better and they can help them move more on their own, stuff like that. So, but that's what we're looking with. So a manipulation, kind of and this might get me in hot water with some of the older chiropractors, but the old theory used to be bone out of place, which is like your bones aren't where they should be, so we push them back in. And that is very, very rarely, a thing. Like we can't, if you take x-rays of somebody, it's not like, oh, this should be sticking out here. And we just, like, that's not how that works at all. But what we do feel for is restricted joint motion. So like a lot of times, and you've probably seen it yourself, like when somebody gets their neck adjusted or something like that, beforehand, they might only be able to go to here. And there's, whether it's a facet joint issue or something like that, we usually do some stretching, some soft tissue work, and then we'll do an adjustment, and then they can go a lot further. That's all we're really trying to get. So with SI joints, it's a smaller degree. You don't have nearly as much range of motion as some of those other articular surfaces like your facet joints and stuff like that. But that little bit makes a big difference sometimes.
While you're focusing on the therapy side, the medical side of getting somebody to feel better, I want to encourage people that if they do have an issue that's recurring, you can kind of start to think about like what's aggravating it. So it's usually one of three things. You touched on it already, but sometimes it can be aggravated by load. So like you said, if you're like, oh, anytime I go above X amount, well, okay, then figure out why. It could be aggravated by range of motion. Some people's hips sit differently than other people's hips. So for them to go ass to grass in a squat, they actually have to compromise a lot of things you shouldn't be compromising to get down there, where somebody else might not have to do that. So like, is it your range of motion? Maybe you need to adjust that in your training. And then the velocity. Sometimes injuries are created by velocity. Like some people, when I squat very fast. Like I hit the hold very hard and I pop right up. And that doesn't bother me at all. Other people, if they try to hit like a super fast squat, they're going to get in really hot water. You know what I mean? They're going to be all over the place and they're going to have a ton of issues and potentially tear something or hurt something. So from a training perspective, obviously, like you're talking from a therapeutic perspective, which I've seen the efficacy of it. I've done it. I've been part of it. From a training perspective, sometimes you have to also think like, if you're constantly injuring yourself in the gym, it's like, what one of these three things is actually impacting it, and how can you make an adjustment? If it's load, maybe you're adding too much too fast. Maybe you thought you could squat 405 when in reality, a real max for you is like 365, and maybe in a couple more months you can keep building to 405. If it's the range of motion, maybe your squat shouldn't look like somebody else's squat. And if it's velocity, maybe you don't have the same myotatic reflex that another athlete has. So like just taking inventory on like, okay, this exercise keeps hurting me. What am I doing that it keeps getting hurt? Then you can make those adjustments. That's our job too, is to try to help people make those adjustments during training so that we can not get there. And then if they do get there, then we can hand them off to you for you to actually do these therapies to help them feel better.
That's exactly 100%. I agree with you. I couldn't agree with you more. That's what I try to touch on. And anybody who has these recurring pains, especially when you work out, I would definitely recommend you see a personal trainer. Make sure that you're doing everything right. Because like you said, it could just be a matter of decreasing your load. Sometimes, especially guys, I think I can hit it. And like, you might be physically strong enough to do it,
right?
But that doesn't mean your body is strong enough to do it. Like that muscle, your pecs might be strong enough to bench 300 pounds, but your shoulders might not be healthy enough, or you know what I mean? Something like that. But there's so many people who keep getting hurt doing the same thing. So if you have recurring pain, there's something wrong with that. You're not supposed to, deadlifts aren't supposed to hurt.
Right.
You might be sore after, you might feel like you work those muscles, but it's not supposed to be painful every time you do it.
Right.
And sometimes, especially people think that like they see like football players working out on TV or something like that. And they're like, oh, I need to do that. And it's like, well, maybe, but if it shouldn't hurt every time, something's wrong.
I mean, not everybody needs to train like a Division I Alabama football player. Some people do.
Or can.
Yeah.
Some people can't do it.
Right. I mean, sometimes when you show like a highlight reel of an athlete, like these are guys at the top, you know what I mean? Like the creme de la creme of athletics and genetics, where it's like, yeah, these guys can go and clean 405 4 or 5 times a week and go out and play on Saturday and then come back and do it again on Monday. Most people need to take a little more inventory on their actual prowess of an athlete. Nothing wrong with that. I think everybody can improve. Most of the people we work with will they just want to get a little bit stronger and lose some body fat and feel good. A lot of the athletes we work with may never compete outside of the high school level, but taking some inventory and being like, I'm going to get as good as I can. I'm going to work as hard as I can. It's really the approach to do. Sometimes it takes a little bit of humble pie, but at the same time, the long term is really what fitness is all about. Another injury we see a lot of has to do with, we all know the guy that before, you know what I mean? He was about to make it to the MLB, but yeah, it's that shoulder issue. He hurt it benching. We see everybody in the gym, if they're not dealing with a lower back issue, they're dealing with the shoulder issue. What typically causes that? I'm thinking barbell bench press. A lot of people, their shoulders hurt with that.
Barbell bench press is kind of, is very divisive when you ask people in the fitness industry about barbell bench press, because some people swear by it and some people say, I don't know why people are still doing it. I usually tell people is it worth it? Like, are you in pain after, stuff like that? Because there's a couple things that can go wrong with barbell bench press. you're kind of putting yourself into a loaded position that sometimes if your form's not always 100%, or if you're deconditioned, something like that, your risk of injury goes up tremendously because you're already in a vulnerable position. So at least from what I see with bench pressing, there are a few main culprits. One is either a pec minor or a bicep tendon issue. So those muscles both connect into your scapula up in the front of your shoulder. So a lot of times when people say they feel like right here, I don't know, I mean, the listeners can't see this, but like in the very front of your shoulder, sometimes when people will say like every time if I do bench, or even it hurts when I do curls, stuff like that, that is very, very commonly an issue there. So anything that's either going to put, a lot of protraction and retraction force on the scapula, when you're in that full bench position, your elbows are cocked all the way back. You put a lot of pressure into the anterior part of your shoulder. So we'd have to poke around to really see, but a lot of times that's either your pecs are too tight, especially pec minor, because a lot of people don't really stretch it, or your bicep tendon. Both connect up into that scapula and both sit in the front of the shoulder there. And a lot of people have probably, either strained or even torn those at some point and they don't even know, like especially athletes. You've probably heard like, yeah, I hit a heavy bench once and I felt something kind of weird in my shoulder. It hasn't been the same since. And that was years ago. You know what I mean? Because if depending on the degree of tear, it might not heal. You know what I mean? So that's a very common issue, whether it's like a tendinopathy or something like that. Another one is rotator cuff issue. So your rotator cuff also comes from the back of the scapula. It's made up of 4 muscles, connects into the arm. And that's what does, rotation of the humerus, right? That's what does like, different positions, especially elevation is an issue. So your supraspinatus tendon, which is one of the most common, it is the most common rotator cuff muscle to injure, comes from the top of the back of the scapula and gets into the arm, and it does abduction. So when you bring your arm
lateral
away,
raise for people.
Lateral raise, yeah. So some people will say they feel pain on the side of their shoulder. This is a lot of that. And bench press is also bad for that because your elbows, and a lot of people are fully abducted to, not fully, but you know what I mean, abducted all the way out to 90 degrees away from your body, which I don't hit my bench like that. I don't recommend people hit their bench like that, but some, especially like old school lifters, like, you get those guys who played baseball and now they're 55, you can probably hit a little bit more weight like that because you're loading the pec directly. Yeah. That being said, now your elbows are abducted. You're putting a lot of pressure. You're driving that supraspinatus tendon up into that kind of bony part of your scapula, and it'll rub in there a little bit, and it can tear. It's not a super. It's a strong muscle for its size, but it's not like your pecs. You know what I mean? That's a shorter, stronger muscle. Yeah. Kind of putting that load. We see this a lot when guys have their elbows abducted, and then they start to fail, and they like turn and put one pressure on one side more than the other, or they try to like muster it up like this.
Yeah. Paddle boarding when they're like doing this.
Yeah. Yep. And then they get up and they kind of have to do this one with their shoulders, where they roll it out a little bit. It's a lot of times that's that lateral pressure on there. So those are typically, and then obviously, you got your trap injuries and stuff like that can contribute to shoulder pain. A lot of people will feel that in the back of their shoulder, but that's really more of like a back problem. It's not really you might feel it in your shoulder, but it's not always. That's just where it connects. You know what I mean? But I would say the anterior shoulder pain, that like either that pec minor or that bicep tendon pain, is super common, or the supraspinatus pain in the lateral side of the shoulder. Those are like, I see those every single day working at the gym.
Yeah, I see that too. Now I'm thinking of 2 customers already that say they have pain right on, and it's almost like the belly of their delt.
Yeah, it could be delt too. So delt also does abduction. So neither your delt or your supraspinatus are strong enough to support what you can bench. You know what I mean? Mm-hmm. So it's possible to injure both of them. So some people do injure their delt, some people injure their supraspinatus, or sometimes it's both. So, but they'll feel that right, like at the top or like in here on the side of their arm. And a lot of times they'll describe it as pain when they try to like raise their arm up or they reach for stuff. That's a like very, very common problem.
I noticed that with, I don't know if it's the same, because I remember looking in years ago about how the femoral head sits into somebody's hip socket. how it sits into the ilium, and there's a lot of variation there. Like, I forget what I was reading, but the reason that typically Asian countries and Eastern European countries are so good at Olympic weightlifting is because of how their hips sit into their femoral head sits into their hip joint. So they can stay more upright when they're doing like an overhead squat for a snatch or anything overhead, or where they have to stay extremely upright. I wonder, and I don't know if you know this or if anybody knows this, if it's the same with a ball and socket joint, like the shoulder. Like some people I notice, I'm thinking about one guy I know who's a great bencher. He's been benching heavy for years and years and years with no shoulder pain, and he does everything that would destroy me on a bench press. His elbows are super flared, his grip is super wide, and he can just crank out 300 pounds for rep after rep after rep. If I did that for 3 reps, my shoulders would be shot for like 2 months. So I wonder if like people, and that's what's cool about exercise is not everybody's exercise is going to look the exact same. Like how I squat looks different than how you squat, looks different than how Zach squat, looks different than how Colin squats. No, there's principles to follow. You know what I mean? Try to get to parallel if you can. There's some people that they don't even go to parallel, just slightly above it. But once they go to parallel, there's a huge compromise in their technique. And I wonder if it's the same thing with bench press. Maybe there's a lot of variation with just ball and socket joints in general. Because for me, I haven't done a barbell bench press in like 6 months. I just don't do it. If I do it, my elbows hurt, my shoulders hurt, but I can do dumbbells. You know what I mean? I can grab some heavy dumbbells and still get a great horizontal press. My chest is sore. It's great. Now, it's not the same as a barbell bench press, and the aggregate total of the 2 dumbbells isn't as much as the barbell. But if I do the barbell as heavy as I could for 5 or 6 reps, I'm going to be out of commission for the next week. So why don't I just do a horizontal press twice a week? So I'm getting twice as much work, even if the load isn't as much as a barbell bench press. And that's what's curious about like exercise in general. And I know this is kind of tangential, but oftentimes people will see how somebody else does a technique and they want to replicate that, which I think is, to an extent, that's good. Maybe replicate somebody's, commitment to the gym, replicate certain principles. But when it comes down to it and you're dealing with issues, you might need to make some adjustments that guy or girl doesn't have to. Like we were talking to Danny from episode 7 from the defense lab. We were talking a couple Saturdays ago at our open mat, and he's like, yeah, do I have to barbell bench press? I'm like, well, why do you want a barbell bench press? He's like, to work my chest. Okay. Can you dumbbell bench press? Yeah, I can dumbbell bench press pain-free. Just do the dumbbell bench press, dude. Like, don't put just because you see some other guys doing a barbell bench press doesn't mean you don't have to. It doesn't mean you have to, rather. You can do something else, do a replacement exercise that you can do pain-free and do several times a week. And then you can keep living your life. And that's what I think, the bench in particular, there's so many people that, because it's the ultimate masculine exercise. Nobody asks you how much can you squat. Nobody gives a shit how many pull-ups you can do. The first question they ask, and even now, even though like lifting has gotten so big, the first question people ask is how much can you bench? And it's like, I get it because it is like heavy and gritty and it's an upper body movement and super masculine, but it really doesn't make sense from a longevity, performance, and health perspective.
I don't know about I don't know of any research where it's comparing the shape of somebody's, shoulder joint itself. But that being said, we're all shaped different. Everybody, even if to some degree, even if you're identical twins, depending on, the wear and tear you've gone through in your life, like there is some degree of variation, right? Mm-hmm. I mean, we are all shaped a little bit different, and you're exactly right. If you know that you're doing something 100% correct and it's still bothering you, don't do it. Right. There's other ways to get the same thing accomplished. Some exercises are way more beneficial for people who have if somebody has shorter arms and a big, broad shoulder, big chest, they tend to be better at benching just because the shape of the person.
It's physics.
Yeah.
I mean, it's just levers. All lifting is levers. Yeah. If you have a better lever for an activity, you're going to do it better. Not only that, now that I'm thinking about it, this dude that I know can bench like more flared out and just crush heavy weights and has been for 30 years. I mean, his range of motion is different, not only because his arms are shorter, but his chest is wider. I could probably flare with my elbows out like this and bench halfway down, probably pain-free for a long time. Now, if I have to bring it the whole way down, I'm going to literally saw my supraspinatus in half
Yeah.
You know what I mean? Whereas he could probably get away with it just because of his levers. You know what I mean?
Yeah. That's different in shape. I mean, it's just like any tool. You know what I mean? You can have two hammers that do different things, right? It's just the same exact problem. Like, you know what I mean? If you have a small, metal hammer, maybe that's good for driving in nails, or like a big rubber mallet. It's like the same, you're not driving in nails with a rubber mallet. You know what I mean?
Right.
It's just the difference, a small difference like that can make a huge difference when you're talking about hitting an exercise once or twice a week, every week, forever.
The only other thing I wanted to add, and we can get into other pains, aches and pains that you see, but what I'm dealing with now, and other people are dealing with it. I know Zach, I think it was either you or Danny on Saturday. It was like, oh damn, my elbows are starting to hurt. I'll give you a short story about what happened. When I was opening the gym, I didn't have a carpet ripper at the time, which is basically this, you can put it on the edge of a carpet, and as you pull, the device actually gets tighter. So it's easy to rip carpet off. We had this commercial carpet in the gym that was just glued in from glue, probably from when the building was built in 1999. I mean, this thing was almost like the carpet and the cement were basically one thing at this point. And I didn't have this carpet ripper, so I'm ripping it up with my hands. And I ripped out this whole room of carpet. My elbows have not been the same since. No shit. They have not been the same in 2.5 years since I ripped up that carpet. Anytime I do a heavy press, anytime I'm like doing too much, I get pain on the outside of my elbow. And I notice more and more people, especially as they get strong, a lot of lifters, a lot of guys that I box with too, they're starting to get pain right. And for people that can't see, it's basically like if I put my palm down, it's the top side of my arm right there. What's that called? What typically causes that, and what can we do about it?
So you're getting lateral epicondylitis. So when we talk about things like position-wise, we talk about them from anatomical position, which kind of looks like palms facing forward. The outside of the body is the lateral side. That's more, lateral. The inside is medial. So it's very common to have one, other, or both. So they both have names. If you get pain on the back side or into that outside of the elbow, a lot of people call it tennis elbow, which is, it does happen from tennis, but that's lateral epicondylitis. So that means that the wrist extensor muscles or the finger extensor muscles, like if you see when I kind of open and close my hand, you see how these muscles stick up?
Yes.
So those muscles will run up and connect into the side of the elbow. So that's what does finger extension. Also has a couple different properties, but that's the big movement for there. So when you were gripping and you were pulling with your wrist probably in a semi-extended position, you're putting a ton of pressure on the tendons of those muscles, and it's going to pull either A, bad enough that you get repetitive strain to those muscles, sometimes to the degree of developing like scar tissue in them, or B, it can actually pull so hard you're pulling on the bone. And that's why if you've ever seen some people who do like repetitive jobs, they got little bumps like on their elbows, like little actual bony bumps, because over time that the muscle has pulled the bone to the point where it's like pulling away from where it's supposed to be. And the bone will kind of grow to support that. But that's severe. That's like long-term, you haven't done anything to address it. But obviously, you did something traumatic to it. Mm-hmm. So that wasn't, you overdid it to the point where it wasn't just like a tendinopathy. It wasn't just like tendinitis where, you repetitively strain it and that tendon gets inflamed. You obviously have strained it or, irritated its insertion point to the bone, something like that, for it to be bothering you for this long. And every single time you lift, I know you've been complaining about it a lot.
For like 2 years.
Yeah. So, and then for anybody who's wondering, that's usually pain on the lateral side. Pain on the medial side is also common. That's would be more considered golfer's elbow. That's from wrist flexion or finger flexion. So if you put your hands in kind of a flex position, you open and close your hand, you can see those muscles kind of contracting and relaxing. But those are both very common, and it just depends on the exercise. So, for you to feel it more on the outside, a lot of people will feel that when your hand is either in far extension or slight extension, so like pressing exercises, because it's really uncommon to have your wrist in a completely neutral position. Mm-hmm. Then you're risking the bar slipping forward and hitting you or something like that. So most people will go into a mildly extended position. Some people really go. Like you probably feel it really bad when you're squatting. Same thing if you're doing a low bar squat.
Yep.
And your wrists are in that full extended position. Excuse me. You're bringing those wrists way back there like that. You probably feel it in your elbows, right? It's the same concept. When you feel it on the medial side, typically that's when people, like I see that a lot when people are trying to hit like pec flies and they're turning their wrists in, or they're doing like some kind of, shoulder exercise, or sometimes with curls and you're turning your wrist too far into a flex position. People can feel it in this area, or like a lot of times like this gripping and twisting motion. People who do open a lot of like jars and stuff like that will feel it, but those are both very, very common. The good thing is, unless there's like a major trauma to it, like you fall and you try to stop it with your hand, or like you might have, really you put it through past its normal either range of motion or how much load it can bear. But in most cases, it's a repetitive stress injury, and then that's a lot easier to treat because you A, stop doing the thing that bothers it, and B, treat it in that area, and we get a lot of good results with that. And it's one of those things too. And I'm sure when you're more careful with your elbow, it probably makes a big difference. But I know just the way that you work out and stuff like that, the intensity, it's hard to keep that in a manageable level. You sometimes try to get the most out of your workouts it only takes a little tweak, and it feels like that inflammation's way back to where it was.
And when you were doing therapy on it, and I should be more compliant with it, it does feel better.
Yeah.
Especially with the shockwave.
Yeah.
I noticed that definitely makes a huge difference.
Yeah. So for anybody who's not aware, shockwave therapy is kind of the layman's term. It's called radial pulse therapy. It's very good at getting into muscle tissue, kind of bringing blood flow, breaking down tension, stuff like that. So we've had a lot of success with it with elbows. But yeah, it's one of those things you have to be compliant with, because you use your hands so much. Most people do. It's not something like if you hurt your hip or your foot or something like that, like, yeah, it's annoying, but there's workarounds. But who doesn't use their hands, whether it's for typing or, your actual job, if you're like a roofer or carpenter, or like, you're heavily involved in fitness, everybody's doing something with their hands. And if you're not doing the steps that are going to require for it to get better, you're going to notice it. Like you said, you were pretty good. I have your permission to talk about.
Yeah. Oh yeah.
You were compliant for like 2 weeks, and it made a really big difference.
Yeah.
Then you get busy, and sometimes I'm busy in the office and I can't, it's without a scheduled appointment, it's tough to fit you in and stuff like that. And between it, all it took was like another 2 weeks, and it's pretty much right back. Right.
Yeah.
That's because you're still doing the things that bother it.
Oh, for sure. I mean? Yeah.
So it started as a traumatic injury. Now it's more of a repetitive stress injury, but if you're doing the things that are going to hurt it, it's going to stay hurt. You know what I mean?
Oh, for sure. Sometimes what is it? Doctors are the worst patients. Clearly I'm not a doctor, but sometimes.
At least you know what you should be doing.
Yeah.
You know what I mean? But your lifestyle makes it difficult to do the things that you're supposed to do.
Yep.
And that, like you said, sometimes you got to work with what you got. You know what I mean? Treat it when you can, deal with the pain when otherwise, you know what I mean? But the big deal is that what you're doing does help. That's a good sign. You know what I mean?
Yeah.
If you were doing things that should help it and it's not getting any better, you got to start thinking like, okay, what's going on? You know what I mean?
What about you, Zach? I know you got a myriad of injuries. Pick one and let's ask him.
I deal with a lot of neck discomfort and a lot of neck pain. That's something that I see Anthony about pretty frequently. And the soft tissue work, the stretching, and then the manipulation definitely helps. I fall into the same boat of the lack of consistency. I'll go to Anthony when it starts to feel really bad, and then it starts to feel a little bit better. And then I'm like, perfect, it's healed.
Yeah.
Until 3 weeks later when I'm like,
like,
Anthony, can you sneak me in? Can you sneak me in?
Yeah. And I hope you don't mind me saying, I mean, with you starting your martial arts journey, I mean, you were a wrestler, so that's really the start of your martial arts journey. But now that you've been doing a lot more jujitsu and stuff like that, and then plus, I mean, you're still lifting very regularly. So, I mean, it is one of those things that you're still doing the thing, right? So you still got to do the things that are going to get it better. I mean, like, again, I'm glad that it responds well to treatment. Obviously, nobody wants to live with a stiff neck. It's hard to look, when you got to make a turn when you're driving and stuff like that. but that being said, it's tough. Like with your, how much time you have and, you guys stay just as busy as me. The issue is there's no, thankfully our businesses are doing well, but there's not a whole lot of time for us to just sit around. It's like you kind of put yourself last, you know what I mean? Mm-hmm. You're like, well, why would I get treated when I could fit a client in here? You know what I mean? For you guys. And then for me, it's like, it's like, oh, I'm booked out until, 6 and who knows when I'll leave, you know what I mean? And it's like tough trying to do the things you're supposed to do. Unfortunately, I haven't been adjusted in a few weeks, which is like, I'm feeling it. You know what I mean? So it's kind of do as I say, not as I do. I try to be as good about compliance as I can, but I mean, everybody's life gets in the way. Everybody's busy. That's part of it.
I know. That's what's tough about it. Well, maybe one day we'll all be independently wealthy and we can do everything perfect.
Yeah.
That's the goal.
I wake up, I get treated, or I work out with you guys first thing while my chef prepares my breakfast.
Yep.
Then we switch. You get treated right away.
Yeah, we got something going.
Let's just work on growing our wealth and then we can worry about being healthy later.
So
that was a joke. Don't do that.
You were talking about chiropractic care. Basically, your philosophy on chiropractic care has to do with movement and blood flow. Is that what you would say most of the therapies and the adjustment are oriented towards, is movement and blood flow?
I mean, we're built to move. So period. Like we are designed, to move throughout our lives. That's why you see a lot of people who have issues who work stationary jobs. You know what I mean? They're just kind of sitting there all day. Those people have just as many problems as like labor intensive people, different problems, different kinds of problems, but they have just as many, you know what I mean? So, and that, like I said before, your cartilage, especially your cartilage is avascular. So what you have to do is, the joint fluid that surrounds that cartilage is how it gets its nutrients through diffusion. So if you're not exchanging your joint fluid by moving it, you're not bringing nutrients. That's going to speed up, arthritis. That's going to speed up, you're not going to flush inflammation. It's just going to sit where it shouldn't, and you're going to be feeling it, stuff like that. So I would say, I've never really thought about it like that. But I mean, movement is a huge aspect of all of our lives. None of us just sit in bed all day. You know what I mean? So, the better I can get you moving, the closer to your normal function, your normal range of motion, your normal comfort level when you move, stuff like that. That's my goal. You know what I mean? That's kind of and other things encompass that, right? Like, so, if you're having muscular pain, that is going to inhibit your movement. So even though we might be treating different problems, trying to get your range of motion back to normal, trying to get your functionality, being able to do your activities of daily living back to normal, that's my goal. Get you functioning better. You know what I mean?
Why do you think
back to normal?
Why do you think some people don't believe in it? They're like, oh, chiropractic care, that's not real.
It's kind of an old-fashioned thought. I mean, even people will think, well, like, oh, medical doctors must hate you. We have a huge network of medical doctors we work with. We work with a ton of primary care physicians, orthopedists, neurosurgeons, neurologists, everybody. And we even work with people also in physical medicine. We work with physical therapists. We work with, everyone that you can think of. So a lot of people, I think it's like, you hear something once and you just kind of like settle in your mind. The majority of the medical field doesn't really think like that anymore, I would say. We work with a ton of doctors on this side of Pittsburgh. It's, they send us patients, we send them patients. So that's not, on that side, that's not as a common thought, I don't think. Another thing too is, it's one of those, people aren't really sure about, they don't understand why it works. You know what I mean? They don't understand, you obviously, if your blood pressure's high, you take a blood pressure pill, your blood pressure goes down. They see that, you know what I mean? So sometimes, and I don't want to say, but there are, just in any field, there are bad practitioners. There's people that you don't want to see. I think a lot of times people will go see somebody who just kind of puts them through the paces. You go in this room, you get this, then you come in here, I get you adjusted, and you leave, you're gone in like 5 minutes. You know what I mean? And those people don't really see the results that they want to see. And then that kind of was, they were like, yeah, I saw a chiropractor once and it didn't do anything. You know what I mean? And it's like, yeah, I bet it didn't. You know what I mean? But you go see, I'm sure you've also been to a primary care physician who's like, you got this, here's a script for it. But then, if that doesn't work, you're like, that guy doesn't know what he's talking about either. You know what I mean? There's bad practitioners in every field. I'm sure there's bad personal trainers. You know what I mean? People that aren't getting anybody healthier and maybe hurting them along the way, unfortunately. So I think that, there's like maybe a misunderstanding there, but typically I don't try to fight it, if that it's not as common as it used to be, but like if people start saying that, I'm like, hey, if you're ready, you come in and get treated, I'll do my best to get you better. If you still aren't buying it, it's like, it's not something you have to believe in. You know what I mean? So if you aren't getting the results that you think you should be getting, then don't keep coming. You know what I mean? You wouldn't keep, if you went to a restaurant you're like, well, I really want a really good steak, and the restaurant kept giving you not good steak, don't go back. You know what I mean?
Right.
It's the same exact thing. If I'm not helping you the way you want to be helped, then this isn't a fit for you. You know what I mean? But I don't think everybody can realize that. But sometimes once you get them in, it's usually easier, because I don't want to toot my own horn. I think I'm pretty good at what I do, and people usually see at least some degree of results, if not total resolution of what their problem was. And then that really, then they're kind of opens their eyes. You know what I mean?
I think it comes back to, and I believe it's called the chiropractic life cycle. It's the posters that you guys have in the offices. It starts with pain management, and it goes pain management, then corrective exercise, then maintenance.
Yeah. So, I mean, the goal is to get to the point where, so it starts as we're treating a problem there's several steps, but we're treating the reason you came in for, right? Then it's, how do we stop this from happening again? And then it's how do we keep you healthy long-term is basically the gist of it. So, I don't know where you were going with that exactly, but that's typically how we get new patients. They come in with something, we get them better. Then our next goal, once they're feeling better, is to try to not let it happen again. Then once they're comfortable with that, then it's like, okay, this is something that's probably going to bother you with you work at a desk. You're always going to work at a desk until you retire. When this is a problem in a month or something like that, like how do we get to that long span where I don't really need to see you until the next flare up or the next, you tweaked it or something like that. You know what I mean? That's the end goal, is to get you so you can go through your normal life without even having to think about seeing me. You know what I mean? Kind of fixing the problem at the core.
Tying it back to the beginning, it's, what are you doing outside of just the treatment? Mm-hmm. I mean, is it any coincidence my elbow still hurt? I still am working on rental properties, still tearing up carpets, still lifting as hard as I can. Yes, when it gets too bad, I go for treatment. But if I'm not doing what I know I need to do, well, no shit, my elbows still hurt. Like if somebody goes to the chiropractor and then they're like, oh, once you go, you always have to go. It's like, that's true. If nothing changes, nothing changes. Right. Like, if you have to go because you're always getting hurt in the same way, then you always have to go because you're getting hurt in the same way. I don't want to gloss over this either, though, but I kind of find it funny with people that disagree with chiropractic care. They're like, oh, that's fake. That shit doesn't work. They can't explain it. I think you're right. The reason they don't believe it is because they can't explain it. But there's a lot of things they do in their life that they can't explain. You press your pedal and the car goes forward. Does anybody that do that know how an internal combustion engine works? Nobody does. Absolutely no one does. But they still go in, they press the gas, and it goes forward. Why? Because people before them did a ton of research to be like, okay, well, this is a fuel injection. It comes in here. This is combustion. It moves a piston. All these different things occur, and the car goes forward. I just think it's funny when some people say, I don't believe in chiropractic care, because I see it at the gym. You know what I mean? People walk by, I don't think that stuff works. It's like, well, how does exercise work? Mm. Nobody knows. It's like you're actin and myosin slide across each other. And there's a lot of stuff that even I don't understand, but I see it work. Mm-hmm. Now, I'm not saying that people should just go into something blindly. That's not what I'm saying. We saw a lot of that over the last 3 years. But what I am saying is just because you don't have a perfect understanding of how something works doesn't mean it doesn't work.
Yeah.
Right? You might not feel comfortable doing it, but you can't make the assertion that it doesn't work just because you don't understand it.
Right.
And I think that's a huge error that people make for some reason when it comes down to chiropractic care in particular. Like, that doesn't, it's like, dude, you don't know how anything works, to be honest. Like most of us have a very small sliver understanding knowledge of anything in this whole world. You're lucky if you know 0.1% of everything. That's still a massive amount of knowledge. If any one person knows 0.1% of all of human knowledge, they're probably a Nobel Prize winner and might actually be a Mensa level genius. But it's like they use all these different things that they can't explain. But for some reason, when it comes to chiropractic care, they can't explain it. That doesn't work. That shit's fake. Yeah. It's like the weirdest thing to me.
And I think it's a problem that a lot of physical medicine has, like, physical therapists and stuff like that. People are like, oh, I have to go to physical therapy for like 6 weeks before they order me whatever. And sometimes I agree that's like jumping through hoops with the insurance company. But it's like, when you're there, what are you doing? Are you trying to get better? You know what I mean? They don't understand why it works. And a lot of people feel like, oh, I need to go through the motions. I do think that it helps physical therapists because a lot of times, like, orthopedists will order it, or insurance companies require it before they do more testing. So I think that gives them a little bit more to stand on. But like the same exact concept, like people, don't understand it, so they don't trust it, I guess. But I mean, that is changing every day. That minority of people are getting smaller and smaller and smaller. I mean, like I said, our network of professionals is huge. If you're regular, and not to put anyone down, but if you're regular Joe Schmo is like, whatever, you know what I mean? Like, okay, that's one person I won't get. But this orthopedic surgeon who's sending me people every day, I'm going to get new patients constantly from that. You know what I mean? And then, as time continues to go on, people are going to be like, okay, maybe I'll try. And then they feel better and they're like, oh, okay. I had a patient like that a couple weeks ago. He was like, this is my first time. He's like, I really didn't want to do this, but my girlfriend made me. And then I've been seeing him ever since. You know what I mean? He's like, I feel way better. He works labor intensive job. And we're still trying to correct the things that he's doing that are bothering him, but he's gotten probably 80 to 90% improvement in a couple weeks. And he said he's felt better than he's felt in years. You know what I mean? So it's not like, I don't know. I try to, like, people were like, I don't believe in that. I was like, it's not something you really have to believe in. It's something you just have to do. Just do it. And if it's helping you, then that's good. And I would say the majority of people, we see at least, results to the point where they're satisfied. And, what they, like you said, what they do outside of there is kind of determine the rest of the way. But I don't really care if you believe it or not. So,
right. No, it makes perfect sense.
I was going to pivot here real quick, and this might lead us down to a talking point that we were going to touch on later. Why is it that most integrative and functional health medicine doctors are chiropractors?
Why? I just think that probably a lot of people who are into chiropractics, physical medicine, stuff like that, those are people who want to work with athletes. Those are people who want to work somewhere in, where health kind of meets fitness and that kind of realm of things. That's where I am. You know what I mean? They probably have an interest in, sports, or an interest in weightlifting, or an interest in something like that themselves. I do think they tend to be a lot more active. I'm sure you guys have been to certain primary care physicians that don't really, live their philosophy. And don't get me wrong, there's a ton of chiropractors who do that too. But that being said, I'm sure you've seen quite a few chiropractors who are also super into fitness.
They're generally in better shape.
Exactly. Mm-hmm. So, I think that it's probably, you end up at that, your goal, because of different reasons. You know what I mean? It's like a ton of wrestlers end up becoming chiropractors. It's very common because, you were in wrestling, you were dealing with those nagging injuries. You wanted something, you started looking into medicine because you wanted to make a good living. You wanted to help people get better, stuff like that. And then you realize that's chiropractic is kind of that avenue, you know what I mean? Where you're into that space because you're passionate about functional movement. You're passionate about getting people, to the point where they can do the things that they want to do, stuff like that. You know what I mean?
I just had noticed that a lot of holistic and integrative medicine physicians, they practice at a chiropractic offices. Mm-hmm. And I didn't know if there was like a theme or a reason because of that.
Yeah, I think the reason is you're more into fitness, you're more into sports, or that was how you got into that. You know what I mean? Is some people, medicine is very important. I don't want any, medical doctors thinking that I think what they do is great, but I think they end up there because it's, a lot of them, they also might have a passion for getting people better, but a lot of them, it's also, financial driven. That if you're a medical doctor, to some degree, you have financial stability, you know what I mean? Stuff like that. And you want to make a good living. helping people, but from a different way. You know what I mean? Whereas I think a lot of people get into the functional medicine because they're like, I was an athlete. I want to work with athletes. I want to make athletes be able to compete at a higher level or help them recover from injury or something like that. So it's just a different avenue.
Do you think the future of chiropractic care is to continue to expand? You're saying more people are receptive to it in the medical community. Zach brought up that there's a lot of integration between different medical fields. You say that's your experience with it as well. Do you think chiropractic care is a growing industry?
It is difficult right now. I mean, within all of medicine, I think chiropractic is growing. That being said, the medical field is in a really tight spot right now. I mean, I'm sure you guys have seen and heard all about the issues with the American healthcare system and stuff like that. So there tends to be the gross number of medical providers seems to be at least, fluctuating, if not going down a little bit, because it's not as easy. It's way harder to make money doing anything like that now. And it's a lot more hoops you have to jump through. So in that regard, I think that, maybe statistically you're not seeing the total number go up. I'm not really sure. I haven't looked at the statistics. I don't know how many practicing chiropractors there are year to year, but I know that, medicine, the American medical system, just like healthcare in general, that is, kind of at a weird spot right now. I know there's, less people going to medical school and stuff like that. So I would assume that chiropractors are probably having a similar experience. I don't really know from that end. You know what I mean?
Is it just because of insurance reimbursement? Is that why it's harder to make money at the chiropractic field?
It's administrative. Insurance is a big part of it. So, a huge portion of my day, and I have staff for this. So this is, their whole job is to manage insurance. And then on top of that, I still have to spend at least a half an hour to an hour every day doing stuff for medical insurance companies. You know what I mean? And that's just for us to make money. You know what I mean? We won't get reimbursed through them if not. So, and that's not just me. That's your dentist. That's your primary healthcare physician. That is everybody is going through these hoops right now, and reimbursement tends to be smaller. So you're doing, you're jumping through all these hoops all day long, and you might not make as much money as you made last year. Unfortunately, our business is growing, but if you just had if your business was stable, you're really probably making less money year on year because your, return is smaller.
If you have to hire additional staff just to jump through the hoops of insurance reimbursement, then by definition, that reimbursement, at least a portion of it, is going to pay for that staff.
Exactly.
Instead of actually going to pay for the provider.
Now, this is the problem you see at hospitals. In my opinion, I mean, somebody who works at a hospital probably has a little bit more clarity on something like this, but the administrative aspect, the administrative cost of healthcare has gone up through the roof. So people think all these doctors at hospitals are getting so rich because look how expensive it is to go to the doctor. My copay is super high. My deductible is super high. So I have to pay all this until I hit my deductible and blah, blah, blah. And they don't realize that the doctor that they're seeing probably isn't making any more money than he did a year ago or 2 years ago, unless the actual practice is growing, because, reimbursement goes down and so much of that is lost. You get lower reimbursement plus increased administrative cost. The requirements that just to get paid, change every year. So you need someone staying on it, or you'll lose a lot of money. You'll work for free a lot if you don't get it right. You know what I mean? And when you're talking about the margins that they're talking about in hospitals, if you're not getting paid, I mean, that one patient could be tens of thousands of dollars. But, for anybody who thinks, I have a lot of friends in the medical community. I have a lot of friends that are also chiropractors or physical therapists or even physician's assistants or even dentists. You know what I mean? They're almost all of them are, if you're not growing your business, you're probably making less money because, or you're making just as much money, but you're spending way longer doing paperwork. It's very frustrating.
What do you think the solution is to that?
That is a really, really good question. I've been thinking about this. I haven't figured it out yet, because you don't want to, you want to make sure that, doctors are doing the best course of care for the patient. The patient is always the thing, you know, and that is everything. You know, the payment is after, you know what I mean?
Yeah.
Every goal of every doctor that you see should be to fix whatever you're going for. That being said, you know, I think sometimes with the subsidization of certain insurances plus the you know, the hoops you kind of have to jump through to get paid inflate kind of the middle part, you know what I mean? Because it used to be, you know, you need a doctor, you go see a doctor, you pay them X amount, your insurance company pays the rest. But now it's like there are 8 different steps in between there. I don't know how to fix that because you don't want to sacrifice quality of care. But that being said, something has to happen because, I mean, you know, thankfully you guys are young and healthy. Yeah, I could be healthier, but I'm trying my best. You know what I mean? But like, none of us see the doctor very much. We don't go. We don't have to pay a lot of money out of pocket for this kind of stuff. But some people either, you know, genetically got the short end of the stick because they have recurring medical problems that they need to address. Or, you know, some people even live a lifestyle that isn't beneficial for long-term health. Those people are going to spend throughout their life a lot of money at the doctor's office. And that isn't, I don't think, you know, I don't know what the fix to that is, I guess is what I'm saying.
Well, they're footing a portion of that bill, but then the vast majority of people paying their premium foot the rest of that bill.
Yeah.
So I forget because in preparation to this, I was looking, I can't remember the exact numbers, so I'm not going to give numbers, but a small portion of the population makes up a majority of the cost of healthcare.
Right.
So it's like, there's a large plurality of individuals that are subsidizing a small subsection of the population to live unhealthy. And like you said, unfortunately, some of that is genetic. Sometimes you get taken out of the knees. You're doing everything right, and then you get a horrible cancer diagnosis, or you're doing everything right and you get hit by a car. So it's like a massive expense, and there's really nothing you can do about that. I think, just based off of my very shallow understanding of the big medical establishment, I wonder how much our cost would go down if Americans were just healthier.
Yeah. We're always, you've seen all those, you know, whatever, Newsweek or Forbes or whatever, all those things every year. America leads the world in obesity. America leads the world in whatever, these types of cancers, stuff like that. You know what I mean? That's a huge burden on the healthcare system.
Right. Like if you, and I don't want to, and we talked about this in Zach's podcast, obviously the body positivity movement does have a good angle to it. Nobody should be laughed at, ridiculed, or lambasted based off of how they look. But the cost of you being fat, unhealthy, smoking, drinking, doing all types of deleterious effects that you have full control over isn't just costing you. It's costing everybody, which I guess that's fine. I get it. But they use that argument against a lot of people over the last 3 years. It's not just for you, it's for everybody else. Well, then why aren't we using that same logic for the person that's 300 something pounds, driving through McDonald's, smoking a cigarette, and then has to go to the hospital year after year after year for heart disease? Were we willing to, over the last 3 years, to point our fingers at other people to be like, this is your fault, you're causing that? Okay. Did those same people ever point the finger at their own chest? Because oftentimes they aren't the healthiest. Point their finger at their own chest to be like, I'm out of shape, I smoke, I drink, and I'm costing the American taxpayer when it comes to Medicare and Medicaid, or the working class individual when they pay for their own medical care. I'm costing this person more because I want to live unhealthy. I think we could probably dramatically cut the cost of healthcare if we actually change the culture around health. Get everybody exercising, get everybody eating real food, not just this hyper palatable drive-through shit. Do things that we know are very basic for taking care of your health. I'm not saying you need to pitch a perfect game. Every once in a while, I still get a pizza. Every once in a while, I'll throw a 2 milligram on. We're looking for sponsorships. I'll throw a 2 milligram on in my mouth. I get it. You don't have to pitch a perfect game. But at the same time, if you realize a small sliver of the population, because of the lifestyle choices they made, are costing everybody a ton of money, maybe we should change the culture there for people to take some ownership and be like, hey, I might actually be the problem here. For Americans, and we talked about this in Zach's podcast too, if you have your family, if everybody just steps the fuck up, whether it's in their business, whether it's in their relationships with their family, but in this case for your health, you are going to change the trajectory of your family. If everybody's eating right, everybody's exercising, everybody's encouraging everybody, you would be crazy how much your family would change. If that happens in a community, crazy how your community change. You do it in a state, you'll have no problems with healthcare. You do it in a country, now all of a sudden we're not arguing about socialized medicine versus the cost of healthcare, because the cost of healthcare has gone down because the culture has changed for people to actually do the right thing.
Yeah.
That might be a pipe dream.
Yeah.
It probably is. But that's at least one solution that I could see actually working.
Yeah. Now that you mentioned, I saw it was an article on the internet about like it was socialized medicine. It was in Scandinavian country. It was maybe Norway or something like that. I don't remember exactly, but it was like, well, they do it so effectively. Like, why can't we have it here? And it's like, because their obesity rate is like 8%. Right. We have like almost 50%. You know what I mean?
Yeah.
And it's like, without doing something, there's no way, if you think I want to pay for healthcare, right? I pay enough in taxes. I wish taxes covered my healthcare. That would be great. You know what I mean? Mm-hmm. But there's no way. I mean, where would the money come from? You know what I mean? And it's like, there's not a lot of emphasis put on preventative care, like whether that be not becoming obese or whether it be, steps that I can take with my nutrition, stuff like that. Now, I mean, if you want to go down the rabbit hole, you can talk about subsidies of like major food corporations that mass produce food that's unhealthy for us, stuff like that. I mean, that's a whole can of worms. We could talk about that all day. But at least from a patient education standpoint, not to put down most providers, but if you go see your primary doctor and you're overweight most of the time, there are excellent primary doctors who would have a more in-depth conversation with you or refer you to a nutritionist. So that's not what I'm saying. But a lot of times in a pinch, like if you come in for a heart condition, they're there to treat your heart. You know what I mean? And then, they might touch on your obesity, but usually it's either, hey, you need to lose weight, and then it's like, then they leave it there. Or they're like, hey, here's a couple pamphlets of like healthy foods, which sometimes they're really outdated. I've had a couple patients ask me, they're like, well, this says it's good and this says it's bad. What am I supposed to eat? You know what I mean? And it's like, well, you need to see somebody for that. Because it's not, I try to point them, help them as much as I can. But I'm like, if you still have questions, you need to see a nutritionist. Right. Because, you shouldn't have to take 4 steps to know what foods are good for you. Most people don't know. Mm-hmm. Like we were talking about this to circle back a little bit earlier. The amount of education that people, the general population, have on fitness or nutrition or, lifestyle, ergonomics, stuff like that is nearly zero, I would say. Most people know, well, I'm supposed to eat avocados because they have good fats. And I'm like, okay, how does that benefit your life? And like, why are good fats good for you? They have no idea, you know what I mean? Or they're like, well, I can't, I've seen now recent with like the keto stuff. People know that carbs are bad. And they're like, well, I can't eat any carbs. They're bad. And I'm like, well, yeah, a lot of carbs are bad. Or too many carbs or carbs of the wrong variety are bad. Mm-hmm. But like, you can't not eat carbs. That's the primary source of food for your brain. You know what I mean? But they don't know. You know what I mean? And you shouldn't have to go 4 or 5 steps to just, what should I eat for breakfast? And then you got to go through the whole thing. And most people don't have any understanding of it. So I agree. That's a huge problem. We could, whether you want to say strain on the healthcare field or what, we could just make everybody healthier with a couple things. You know what I mean? Yeah. Like number one, if public school needs to, I know everybody takes probably one. You guys went to Franklin, right? How many nutrition classes did we have?
Oh, there was a lady that everyone said she drank her pee. Yeah, she did like a half a nutrition class on that.
It was half. So you remember that? That was 1 year gym class. It was like half sex ed and half nutrition. Yeah. So
you got to watch somebody give birth, and then you got like
one half of one semester in high school. You learned about nutrition. That was it. Or especially we had back then the food pyramid, you know what I mean? Or at that point, I think it started to transition into the food circle. But like, if a poster in your cafeteria is your level of nutritional information, the likelihood of you becoming obese are substantially higher. I mean, ridiculously higher, because you don't know. Or, you know, especially what is super harmful to people right now as far as their fitness goes is inflation, because the cheap foods stay cheap.
Yeah.
And I mean, have you guys brought produce lately?
Right.
Have you bought eggs lately or milk? It is freaking expensive. So, and I feel for those people. Like if you're lower income, you can eat healthy. It's way more work though.
Yeah.
Especially if you know, maybe you're a working class household and you have 3 kids and you work a job, 2 jobs, both people are working, you know, both, if there even is 2 people, you know, people running the household, but like, that is super expensive. You know what I mean? And it's hard to eat healthy like that. So, you know, that hurts also.
I agree. I almost wonder, like, and obviously I'm not saying we should be a Spartan society, but, you know, there were societies throughout history that looked at the education of your brain is very important, which it is, but the movement of your body is equally important, which it is. Like, we spend how much time in school sitting on our ass, learning a whole bunch of stuff, which I'm not saying that's unimportant, but then you might have 1 or 2 9 weeks every year where you do a gym class. It's like, really? We're going to spend 8 hours sitting on our ass and 45 minutes doing some exercise? How is that any balance at all? I don't think it is. It's just that I think the culture needs to change from the ground up to actually include things and promote things. And I don't know if it needs to be a government program per se, but a change in culture to promote health, fitness, wellness, appropriate nutrition.
Or just, if you want to expand that, just things that are important for the rest of your life. Like, how many times have you heard like somebody, a 22-year-old or a 24-year-old who's like, yeah, I wanted to open a checking account in the bank and I have no idea how to do a check. You know what I mean? And they're like, well, I had 1 business class in high school. You know what I mean? And that's crazy, because you're writing checks the rest of your life, or using, you know, your bank account at least, or, you know, you're trying to invest any money. Nobody knows about investing money until you learn about it later, if that's something you even do. Most people don't, unless their work provides it.
Right.
But the same thing with health. It's like, and don't get me wrong, I think that knowing things is super important. I think that, you know, history is incredibly, incredibly important. I love history, and I don't know how you fit more in the day. You know, that's for somebody else who's more involved in education to understand. But how do you not make more time for things that are going to affect somebody for the rest of their life? Fitness, nutritional education, stuff like that. You're going to eat forever, right? Or if you're not going to make it very long, right? You know, to be able to just go in blind for that, like, I mean, thank God I am where I am, because I would, you know, if I wasn't for wrestling, if it wasn't for moving into becoming a chiropractor, stuff like that. And even then, even with all that, I put on a little extra weight. You know what I mean? People and I know what I'm supposed to do. People who have no idea, I don't know how they get by. You know what I mean? It's crazy.
Well, I don't know if we'll solve the problem today.
I don't think so.
But Anthony, I thought that was informative. I definitely took a lot out of it. I know that, you know, anybody that's worked with you, that come to the gym, they know you're good at your job. But for those of the people listening right now, tell us about the rehab center, where you're at, and how we can get a hold of you.
Yeah. So I'm Anthony Petrarca. I'm with the rehab center. So we have 8 offices in the Pittsburgh area. I'm in primarily the Delmont office or the Katanning office, which is in Armstrong County. We also have locations in Apollo, Lower Borough, Clarion, Brookville, Wexford, and in the north side of Pittsburgh. We treat anywhere from senior citizens to athletes. We try to do specialized care depending on what you need. But that's pretty much it. You can catch me in Delmont on Wednesdays and Fridays. I'm up at Katanning Tuesday, Thursdays, and Saturdays. I get Sunday, Mondays off unless it's an emergency. So we do take those sometimes. So, but yeah, that's it. That's me. That's my business. If you have any questions on, you know, if you've had a pain that has been bothering you for a long time, or anything that you think should be different about your physical health that you want, you know, somebody's 2 cents on, come in, stop in, make an appointment. We're pretty flexible as far as that goes. We do accept almost all major insurances.
Perfect. Let's wrap it up.
Cool.
On 3.
Yeah.
1, 2, 3. Again, guys, this is a More Complete Beast podcast. If you learned something, do us a favor, leave us a 5-star review wherever you're listening to this podcast, and share this podcast with somebody who needs to hear it. Until next time, we will see you in the next episode.